Good morning all, how are you today? I hope you're having a lovely day. I just wanted to jump on in and have a chat to you. We're continuing on with our discussions around the autonomic nervous system. So today I'm talking specifically about the autonomic nervous system and concussion. We'll be touching on what happens in concussion, and what is thought to be the cause behind some of this autonomic dysfunction, and then some treatment ideas post concussion to help with autonomic dysfunction. So stick around if you want to hear all about that. For those of you who haven't met me yet, my name's Sarah Hopkins. I'm the owner and one of the senior physiotherapists here at Hibiscus Neuro Rehab. And I'm bringing you these videos to give some education and advice around managing neurological conditions. So, autonomic dysfunction and concussion. We've touched on what is the autonomic nervous system in a couple of other videos, but just as a quick overview, we're talking about the automatic part of our nervous system, which generally breaks down into the sympathetic, the fight and flight system, or the parasympathetic, the rest and digest system. Please feel free to check out other videos if you want to know more about those. So what happens in concussion with autonomic dysfunction? We're now looking at concussion as having different phenotypes and subtypes of concussion, one being physiological or autonomic disturbance, being a clinical profile or subtype or phenotype of concussion. And it's thought that when someone has a physiological subtype of concussion, that it occurs from the uncoupling of the autonomic and cardiovascular systems, and this leads to dysfunction and altered cerebral blood flow to the brain. Stumbling on my words this morning, obviously. So impaired blood flow to the brain. And it can present with things like exercise intolerance, altered heart rate variability, altered pupillometry or pupil size, an elevated resting heart rate, poor postural responses, especially to gravity, and sometimes it can lead on to things like POTS, which is positional orthostatic tachycardia syndrome. So just touching on, if we talk about exercise intolerance for a moment, exercise intolerance is probably the biggest thing that we see with autonomic dysfunction post-concussion, and that's the inability to exercise at near age appropriate maximum heart rates due to exacerbation of concussion-like symptoms. So that's when people feel dizzy or lightheaded or get their headache or have visual symptoms when they're exercising. So that's that part of concussion and autonomic dysfunction. Other symptoms that have been thought to be linked to autonomic nervous system dysfunction are things like headaches, mood disorders due to the links from the autonomic nervous system through to the hippocampus and the amygdala, cognitive impairment. It's been shown that especially verbal memory isn't laid down as effectively when there is autonomic dysfunction, GI or gastrointestinal and digestive issues, so people having problems with their stomach because of the links to the vagus nerve in the autonomic nervous system, sleeping disorders, and balance disturbances as well because of the links through to the vestibular system. So, and it's commonly thought to be a response to the sympathetic response or sympathetic dominance that also leads to some of this ongoing inflammation or oxidative stress within the systems. And one links the challenges with either parasympathetic or sympathetic nervous system, and it's thought that it is the sympathetic dominating over the parasympathetic that appears to be a problem, and that there's a reduction in parasympathetic activity post-concussion that causes some of these symptoms. So the autonomic nervous system is really foundational for building block for our functioning, and it's been shown that the autonomic nervous system is really key factor in some of these symptoms, and it's really important that we address the root cause of this autonomic dysfunction. So when we're looking at this, some of the exercises that we can be thinking about doing and helping with concussion includes sub-threshold aerobic exercise, meditation or mindfulness, use of biofeedback, and breathing practices. There's also techniques to help upregulate the parasympathetic nervous system through vagal toning, which can be really beneficial as well. I just wanted to touch a bit more about sub-threshold exercise. So we know that with exercise, to improve autonomic dysfunction, we're wanting to do a baseline test, normally the Buffalo concussion treadmill test or bike test, which gives us a heart rate that the client's symptoms come on, and then we can use that as a baseline for our exercise prescription. And we want to start off slowly and build up to doing at least 20 minutes at the heart rate that the client can tolerate for 5 to 6 days a week, so that we're really getting that change to the blood flow and recoupling the autonomic and cardiovascular system and improving that cerebral blood flow, as well as exercise helping with learning as well. So we also want to think about what drives the sympathetic nervous system or the autonomic nervous system as a whole. When our system detects a threat or an error, which is also perceived as a threat. So what that means, when we get these messages, that means we will get an altered sympathetic nervous system, or will drive the sympathetic nervous system, which is our fight-flight system. And when this is happening, it means we're getting into that altered state of the autonomic nervous system. So a threat is the words we say to ourselves. So it's really important that we're looking at things like stress and anxiety, negative mindset, thoughts, PTSD, poor lifestyle habits, sleep, nutrition, lack of movement, any emotional triggers, and fixed mindset to really regulate that threat response from the words that we say to ourselves. And then we also have to address sensory integration. So when we have visual and vestibular dysfunction, we can get an error signal, which will also drive up the sympathetic nervous system. So we have to use things like breathing and stress management techniques to lower that anxiety and stress level for clients, to really then help address those errors that the body perceives as a threat. So we're not continuously driving the sympathetic nervous system. So what you want to be doing is finding where the visual, vestibular, or proprioceptive sensory mismatches are, and then addressing those, but also incorporating your exercise piece and the increase in the parasympathetic nervous system, and allowing that stress and anxiety come down through breathing practices or things like palming, face in cold water, using the mammalian dive reflex, or things like gargling to increase, gargling, humming, or harmonicas to increase the vagal tone. So those are some things that can really help with the autonomic piece that happens post-concussion. And I think it's really important that we're addressing this when we're treating these clients, or when you're working with someone with your concussion, that you're, bringing down those anxiety levels that are completely normal post-concussion because of the way that the nervous system is wired, and that we then are able to address those other pieces. So get our nervous system in a state for learning so that we can make the changes that we need. So hopefully that's really helpful. I know it's quite a long video this morning. I hope that gives you some insight into why we're getting autonomic dysfunction post-concussion and what we can do about it in a brief word. If you've got any questions, feel free to pop them in the comments below, or send me an email, sarah@hibiscusneurorehab.co.nz. Speak with you later. Thanks. Bye.